I think TMS is an excellent option for pregnant patients because it doesn't have the same systemic side effects or drug-drug interactions that an oral medication might. I'm Frances Javier, the medical director for Neuro Wellness Spa, Marina del Rey. My daily work here at Neuro Wellness is something I'm so excited to do on a daily basis because I get to provide cutting-edge biological treatments to patients every day, and I get to witness their improvement and them getting their quality of life back. With pregnancy, there are physiological changes that happen. There are hormonal changes that can affect our mood, our cognition, anxiety, etc., the way we respond to stress. There are also physical biological changes that happen. For example, our gray matter cortex shrink when we get pregnant, and TMS can be very helpful because it helps improve our mood, our anxiety, our sleep. The reality is, there are changes, and TMS can help mitigate those changes by improving the neuroplasticity and making us feel more focused, improving our energy, and just making us feel more resilient to not just recover from the pregnancy and birth, but also take care of the brand new infant. With any treatment discussion, it's always a collaborative effort between the patient and their clinical providers, especially in pregnant patients. So very commonly we collaborate with the OB team, the patient, see what would make the most sense. It's always risk benefits. Usually, unless there is a strong contraindication of continuing the medication, for example, there are birth defect risks in the first trimester, most of the time we recommend that people continue their mental health medication. If we're talking depression, most of the time people are on antidepressants, and majority of the time our recommendation is to continue their oral medications because untreated mental health disorder has also negative sequelae in both mom and baby. I think with maternal mental health, there are a few things. There's early detection, there's treatment, and social supports. With early detection, I know nowadays it's pretty much part of the practice either in the primary care physician's office, the pediatrician's office, and the OB-GYN's office to do a lot of these depression questionnaires to help screen for mom and catch symptoms early. Because sometimes it's hard to realize when things are changing for you, you're functioning not quite as optimally. Is it depression? Is it sleep deprivation? Is it I'm adjusting to being a new mom? And that's one way of getting ahead of the problem. Seeking mental health treatment with a professional, psychiatrist, therapist. We are well trained in determining, is this a normal or expected physiological changes in your mood, or is this kind of veering into major depression realm? And it's very helpful to get ahead of it because, we don't want mom's physical health to suffer and baby's physical health to suffer. And as you know, those early years in child development are crucial, especially the bonding between mom and baby. And when you're suffering from depression, you can't really effectively do that. And with social supports, whether it's family, friends, or support groups, it's very important for moms to get that support from the outside as well.